Imagine this. A car accident happens. One person can't breathe, another is bleeding fast, and someone's heart suddenly stops. There's no time to waste. Every second matters. This is where the heroes of emergency medicine and critical care step in. Not with capes, but with stethoscopes, fast hands, and sharp minds. This field is all about saving lives when every heartbeat counts. Let's dive into the thrilling and life-saving world of emergency rooms and intensive care units, where science meets speed and compassion meets chaos. What is emergency medicine? Emergency medicine is the branch of medicine that treats people in sudden, serious, and life-threatening situations like accidents, heart attacks, strokes, allergic reactions, or injuries. Doctors, nurses, and paramedics in this field are trained to think and act fast, often within seconds. They work in emergency rooms, ERs, ambulances, and even disaster zones. Their mission? Keep the person alive until further care can be given. What is critical care medicine? Now imagine a patient in the hospital whose lungs aren't working, or whose heart needs a machine to keep beating. That's where critical care medicine comes in. Also called intensive care, it deals with the sickest patients, those who need machines, round-the-clock monitoring, and complex decisions. These doctors and nurses work in ICUs, intensive care units, where life-saving technology and teamwork give people a fighting chance. What do students learn in this field? Students studying emergency and critical care medicine learn how to handle trauma, like car crashes or gunshot wounds, airway, breathing, circulation, ABCs, the first steps to save any life. Heart attacks and strokes, recognizing signs and giving fast treatment. Shock and bleeding, how to stop blood loss and restore pressure. Sepsis, deadly infections that shut down organs. Mechanical ventilation, using machines to help people breathe. Monitoring vital signs, tracking oxygen, heart rate, and more. Emergency medications, when to use adrenaline, fluids, or sedatives. Ethics and decisions, sometimes choosing how and when to intervene. They also learn teamwork, communication under pressure, and how to stay calm when others panic. Real-life example, 1 minute to save a life. Let's meet Ali, a 45-year-old man who collapses at a restaurant. An ambulance rushes him to the ER. The emergency doctor quickly checks his breathing, pulse, and pupils. Within minutes, they shock his heart back into rhythm using a defibrillator. He survives the heart attack. But his condition is still fragile, so he's moved to the ICU, where critical care doctors monitor his heart, give him oxygen, and adjust his medications every hour. After 5 days, Ali wakes up, confused but alive. That's emergency and critical care medicine in real life. How this field works in hospitals and research. In hospitals, emergency doctors handle first contact crises 24/7. Critical care teams treat patients with organ failure, sepsis, or coma. They work with surgeons, neurologists, and cardiologists to save lives. They use advanced tools like ventilators, dialysis machines, and monitors. In research, scientists ask, how can we treat trauma faster? What's the best way to prevent brain damage after a stroke? How can AI help in ICU decision-making? What's the best method to control infections in critical care? This field is constantly evolving because medicine in emergencies has no room for error. Why this knowledge is the foundation of every medical worker. Whether you're a nurse, surgeon, pediatrician, or future medical researcher, you must know how to save a life in an emergency. Emergency medicine teaches you how to think fast, act wisely, and work under pressure. Critical care teaches you how to keep people alive when machines must take over. This field represents the battlefield of medicine, where decisions can mean the difference between life and death. Emergency and critical care medicine is not just about speed. It's about grace under fire. It's about never giving up on a life, even when things look impossible. So, if your heart beats faster at the thought of saving lives, being there at someone's worst moment, and helping them survive it, this field might be your calling. Stick around. We've got more life-changing topics coming, because medicine never sleeps.